must take
their medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure. Good day, dear, and welcome back to DDM House News Update on our program. Young How? You're well. As usual, I remind you that to subscribe to our YouTube channel, that is Diaspora Digital Media, so you get the latest on health. Well, an endocrinologist, Dr. Ayuba Mugana, has advised patients with diabetes to avoid walking barefoot to reduce the risk of foot injuries and amputation. Yeah, he said this in an interview with the news agency of Nigeria on Wednesday, that is now in Bauchi. Mugana underscored the importance of proper foot care for those with diabetes, noting that diabetic foot complications were the second most common cause of amputation after road traffic accident. Check your feet regularly. If you feel pain or notice any form of injury, consult your doctor immediately. Please. Mugana also cautioned against wearing tight footwear and socks as they could resist blood flow to the feet. So, he recommended using nail clippers rather than razor blades for trimming toenails to minimize the risk of injury. That way, injury is the most common cause increments of diabetes. If you are a diabetic person and you have an injury, you can see that it takes time to heal. It might not even heal. So to prevent such, not having injury definitely is the break. Just like this been spoken, prevention is the best. Alright. Mugana further advised diabetic patients to seek early medical attention for early foot injury to prevent complications leading to amputation. This is very, very serious, and you don't have to mislead this. Take note of this. Your foot, the injury you have in your foot might increase the rate of your diabetes. But next, as part of effort to educate the public on prevalent illness in Abuja, healthcare professionals are raising the alarm on malaria, one of the most common and deadly diseases affecting residents across Nigeria. Yeah. In an interview with the news agency of Nigeria, that is NAN, on Wednesday in Abuja, Dr. Bayo Ogudeyi of Lupe Primary Healthcare Center said that malaria remains the leading health concern at his facility. You can imagine. The World Malaria Report 2025 states that Nigeria bears the highest burden of malaria globally, accounting for 27% of global cases and 31% of global deaths. We see malaria more than any other illness every day. Many people don't take it as anything, but Oguyedi identified common symptoms of diseases, such as high fever, chills, sweating, headaches, nausea, and so many other diseases. All these things are the symptoms of malaria. So when you see this sign, have it in mind that these are the symptoms of malaria. So you need to take your medication as soon as possible. But Ogudeyi underscored the urgent need for prevention, describing it as the most effective approach to tackling the disease. Just like I mentioned earlier, prevention is better than cure. Yes, let's prevent first. People must use insecticide, that is insecticide-treated bed nets, eliminate stagnant water where mosquitoes breed, and ensure regular indoor spraying. All these things can prevent the causes of malaria today. Ogudeyi also advocated for early and appropriate treatment, recommending the use of artemisinin-based combination therapy in line with national medical guidelines. Of course, expressing more concern, Dr. Kisley Akanye of Nisa Premier Hospital noted that both adults and children frequently presented with malaria infection. Malaria can become life-threatening. We don't see it as anything but it is. If not treated promptly, it can cause I don't know how to exaggerate it, but it causes a lot. You don't see it as anything, but that's where malaria is really, really deadly. Don't take it for fancy. Don't take it as a joke. It's just malaria. It's not a joke. It's a disease. So please, your health matter. Like I said earlier, prevention is better than care. So we have seen patients with complications like severe anemia and organ damage due to delayed intervention of malaria. You can imagine malaria leading to anemia. You might wonder, what is anemia? Anemia is the loss of blood. Then you don't have any blood. Then you go for your PVC test and you don't have any blood in you. That word malaria can finish up the blood you have in your body. I'm sure you don't want to fall victim. And also, organ damage. You might wonder, what kind of organs? Your liver, your kidneys, your lungs. All these are special organs that helps you grow healthier, that helps you live longer. When they are damaged, you are nothing going. Of course. So your health matters. All these organs in your body is what keeps you alive. It's what keeps you fit. It's what keeps you strong. So please, don't joke with it. Meanwhile, Dr. Tosin Oguyemi of Lube Health Post emphasized the vulnerability of children, noting a sharp rise in pediatric malaria cases. Many people might not see it. They might be like, well, what is just a malaria? Let's just say just a child. No, you have to take a very good, serious relationship in this aspect. We are seeing a lot of children presenting with malaria. It is vital that parents take precautions by making their homes mosquito proof and seeking medical attention at first sign of illness. So please, don't waste time in seeking for medical attention. The experts further urge residents to prioritize prevention, especially during this rainy season when the risk of malaria transmission is at risk, is at stake. So we need prevention this very time around. We need prevention because it's better than care. You can see we are in rainy season, so please, your health matter. Always have it in mind that mosquitoes are roaming about looking for where to go to perch. So please, the question you have to ask yourself, is your house, is your room mosquito proof? Do you have a well insecticide nets, bed nets to cover up yourself against all these deadly infections called malaria? So these are things you have to check. We are also called upon public health authorities and stakeholders to intensify malaria prevention campaigns, just like I'm doing right away. Because if you're not listening to me, you don't have known that all this had to be prevented. So we ensure that the wider distribution of treated mosquito net and anti-malaria prevention. Yeah, the wider we distribute anti-malaria medications, the wider the the decrease of malaria parasites reduces. So, actually today, combating malaria is a collective effort. Of course, the experts also said that through early detection, proper treatment, and effective prevention, the burden of the disease in this country, this is the FCT of Nigeria, could be significantly reduced and many lives would be saved. You might be also opportuned in order to be mosquito free if you should get all this saved. Because your health matters a lot. Always remember that your health is your wealth. If you don't prevent yourself from mosquito, then how do you think you'll be malaria free? Definitely you will not. So, prevention, they say, is better than cure. So please take note of this. Well, with these viewers, we come to the end of our discussion on your health, your wealth. Please do be sure to click on the like button, share, subscribe, and comment on our YouTube channel, that is Diaspora Digital Media, so you get the latest on health. Until I come your way next time, I am Nene Michaeling. Bye for now. Do have a lovely day. Must take their medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure, drug